experts say women should be able to buy emergency contraception without needing to have a consultation with a pharmacist first. It's part of a wider report by the Royal College of Obstetricians and Gynecologists called Better for Women, which has identified how there should be better healthcare access for women. Let's get more on this. With me live in the studio, Professor Leslie Regan, who's the president of that association. Welcome. So should it be a complete free-for-all?
No, not a complete free-for-all. Well, what we're saying is that so many women are finding it very difficult to access basic needs, contraception, cervical screening. We just want to make it easier for them. They've got lots of other things to do in their lives, and we need them to get on and do that rather than fighting a system which is, unfortunately, a very good healthcare system, but the way we're commissioning it at the moment often means that you or I will have difficulty getting some very basic maintenance checks done swiftly.
So you think the morning after pill should just be sold straight off the shelf with no need for medical checks around it?
It's a very, very safe preparation. This is something when you've had unprotected sex or perhaps a burst condom or something like that, that you can go and ensure that you don't become pregnant.
If the morning after pill should be sold off the shelf, then why not the pill itself?
Well, that's a very good point that you raise, and indeed the progestogen-only pill is something that we are asking, can this please be something that you can easily access, go onto the general sales list. There's 60 years of research into these hormonal preparations. They really are very, very safe, and we want to see if we can try and combat the fact that the unplanned pregnancy rate in the UK is currently a staggering 45%.
I mean, obviously, if these things were available off the shelf, it would free up a lot of time for GPs who obviously have to take the time to prescribe it. It would make things a lot easier. What about health issues, though, around it, and having a proper consultation where somebody is talked through what the side effects are, and also making sure that not just anyone can walk in and get it off the shelf?
Well, it's very important that women do consult healthcare practitioners about these issues, but remember that they're having to go back every time they need a repeat prescription. It should be sensible for the women to have a supply of contraception for a year. Even better, that they have long-acting reversible contraception, which then has to be removed when they want to become pregnant. That's the most effective form of contraception.
I mean, what I'm thinking when I say just anyone going in and getting it off the shelf, young, sort of inappropriately young kids may, and it's a free fall, isn't it?
Well, in all the countries,
just on the shelf.
There are many countries that have actually introduced this. Some in Scandinavia and in Canada, and all of their data suggests that it's not misused. That actually it's treated very respectfully by girls and women. But it just means that there aren't so many unplanned pregnancies.
And is there any indication that this is likely to happen?
I very much hope so, because I'm sure that the people who are running our health services, NHS England and the commissioning groups, the local authorities, I'm sure that they will want the best outcomes for girls and women. So this isn't a sort of a massive change. This is just trying to build the services around women's needs and take away some of the barriers to access.
I mean, currently there are 205,000 abortions were performed last year in England and Wales. What impact do you think something like this could have on a figure like that?
I think it could have quite a significant effect. We also know that, in fact, it's not the teenage pregnancies that are going up. That's actually gone right down. It's women in their later reproductive years who are all stating or telling us that they find it difficult to access contraception, who are then finding themselves with an unplanned and unwanted pregnancy and then are requesting an abortion. So there's a very, very clear sort of theme to this, that if we make access easier for women, that we actually do ensure that they don't have so many problems to deal with. And as you rightly said, it really does reduce the amount of services that we're using, and that will reduce our costs.
Professor Leslie Regan, thank you.
Thank you.